Hello, welcome back. We are continuing. In the previous presentation, we were talking about subjective assessment. We are still on chest assessment. So we are saying subjective assessment is the kind of chest assessment where you allow your patient to express uh, their opinion or to bring about their viewpoint on their condition. They will tell you about their condition in their words and in their description of how they are feeling. So now following that up, you are going to follow that up with what is known as an objective assessment. Okay. Once the subjective assessment has been done, completed, there will be indicators on what to look for during the objective assessment. So now you know that when you go into objective assessment is simply, you're simply going into objective assessment to confirm what the client was telling you. If they told you that they have pain, you are going to confirm that kind of pain, if that pain can be reproducible or it is something, because it is very common and very doable that the patient might fake the signs and symptoms because maybe they want to get away with anything, including some jail sentence. So they may fake the symptoms or the presentation that they'll give you. So it is very important that once they tell you, you confirm so that you now come up with a scientific and scientifically informed conclusion, which will be given by your diagnosis. That is why you are trained so that you do not side with wrongdoers in terms of such kind of conniving. You will get to be objective and give the findings as scientifically reasoned. Okay. Therefore, a thorough and detailed objective assessment will assist with the planning and management of an individualized treatment program that focuses on the presentation and needs of the client. You need it so that you can tailor your treatment to the needs of the client. Remember, all the treatment that you are doing has to be to yield some benefit to the client. It has to be beneficial to the client. So if you don't even know what your patient is really presenting with, it will be difficult for you to give treatment that will be beneficial. Okay. To start with, you have to receive your patient well. Make sure you put them in a very comfortable position, depending on their condition. Okay. Depending on the patient's condition, put them in a comfortable position, which could either be sitting, supine, or in whichever position that they would say they are comfortable in. Make sure that you place them comfortably before you continue. Then expose the necessary parts adequately. Okay. Ideally, the patient should be undressed. Okay. Should be undressed from the waist going up, taking care and to ensure that the patient is not cold. So that would also go with the weather. Make sure you're in a well-ventilated, warm room with clean linen on a nice plinth or on whichever structure that you want them to sit according to the available resources where you are. Let them sit comfortably in such a place. Then have them exposed adequately, taking into consideration that of the weather. If it is too cold, expose the parts as required. Okay. Before you continue, it's very important that you take care of the vital signs. Make sure you are aware of the vital signs because they give you the operation of the vital organs inside. They give you an insight of how the vital organs are operating inside. Make sure you take care of the temperature. Take note of the temperature, take note of pulse, respiratory rate, blood pressure, as well as oxygen saturation, which is usually found in patients that are breathing using some kind of support. Oxygen saturated will be found. In conscious patients, it's you may not find it, or you may not even measure for it. Okay, so take care of the vital signs. Make sure they are all within the normal observable ranges. Okay, stand in front of the patient and observe. Observation has to be general and local. So start with general observation. Observe evidence of respiratory distress. If they have any, we include one of the following. Number one, you have to observe the rate of the rate. Observe the respiratory rate, the rhythm of their breathing, the depth and effort of breathing will show that this person is actually struggling for breath. You are observing, okay? Assess the patient's color. Are they looking cyanotic? Okay, if they are, you have an idea where that is coming from. Listen to the patient's breathing. Is it audible? Is it quiet? Okay, or does it sound like they are struggling to breathe? Look for the use of accessory muscles. Okay, we know the accessory muscles and we know that the diaphragm is the main muscle, is the primary muscle of respiratory, which they are supposed to use in diaphragmatic breathing exercises. We looked at this when we were looking at the concepts of breathing. So if you have forgotten, refer to to that lecture and go through. Okay, not any retraction of the intercostal muscles during inspiration. Check lower interspaces anteriorly and posteriorly. Make sure you check everything that is observable. Now we are just focusing on what is observable in respiratory conditions. Okay, so in respiratory conditions, make sure you don't leave out this. Also, make care enough to also check their weight. You get to know if they are obese or they are underweight, their height, all that will be taken care of under BMI. So make sure you check their BMI. It is important for the diagnosis for an accurate diagnosis in respiratory conditions, in cardiopulmonary conditions. Make sure you also check the nails, the nail beds. How are they? Are they clubbing? Are they straight? Are they clubbing? Are they drying up? Check the nails. They'll tell you a story. Check their eyes. Okay, if they are pallor, indicating anemia. Okay, if they are jaundiced, check their tongue to show you cyanosis. Check general body and see if they may have signs of pressure sores or they are showing some signs of being bed bound for a long time. All those will give you a story. If somebody has been bed bound, we have an idea of what that brings about. Okay, it reduces activity of the respiratory system. So it gives you an idea of what kind of condition they are likely to present with. And at the end of the day, the accurate diagnosis will lead you to accurate intervention as well as accurate intervention so as to bring about beneficial effects of your intervention to the patient. Okay. Observe the chest diameter in both transverse and anteroposterior. Are they kyphotic or there is kyphoscoliosis in there? Is it peritus carinatum or hyperinflation barrel chest, indicating the barrel chest? So check the shapes of the chest. The normal one looking like that, okay? Looking like that, where the inner part is curved in. This is the vertebrae, and like that. Okay, so this is on the sternum. So you check how it is presenting. Okay, check how it is presenting. If it is barrel chest, they will show a chest that is rounded up like a pipe. A pipe is round, so that is how the chest is going to look like. Okay, is it bent in some way? It's presenting with scoliosis. Is it pectus carinatum, pectus excavatum, or it's kyphosis that they are presenting with? Okay, all these are things that you are supposed to ascertain. Okay, pectus excavatum presenting like this, where there is a depression on the sternum, okay? And where there is an extrusion on the sternum protruding outside, presenting what is known as vipritas carinatum, and check if there is a scar in there. These are things that you are observing, you are checking, you are trying to confirm to get to something. The breathing patterns. Typically, the normal rate of breathing is about 12 to 16 breaths per minute. The typical inspiratory and expiratory ratio, the inspiration is quite faster than the expiration. So with the ratio of 1 to 2, okay? 1 to 2. So that means if you are breathing in 1 second, 2 seconds should be for breathing out, meaning anything less or beyond this is a deviation from the normal. It has to be taken care of. You have to actually probe it further and know exactly what it means. Check for bradypnea, tachypnea, or hyperventilation, prolonged breath, okay? Prolonged breath. The ratios 1 to 4, you would find that if it is prolonged, it could be to 1, go up to 1 to 4. Then it should give you some hints of what the problem could be. So these are things that you're supposed to focus on. The respiratory type of respiration. Are they pressing their lips when breathing? Okay. Are they presenting with apnea, hypopnea, and all these types of breathing that are there? Make sure that you check, because each one of those leads you to something, and that is very important towards the diagnosis. If the patient is in ICU, check the mode of ventilation that they are using, the route of ventilation, and take note of their Glasgow Coma Scale. Make sure you check the Glasgow Coma Scale so that you also understand how uh, how to approach them or how to deal with them. Palpation has to be done in the chest, to start with palpating the trachea. 4 to 5 centimeters of the trachea can be felt in the neck above the sternal notch, just above the sternal notch. You can feel at least within 4 to 5 centimeters of it, you can feel it within that notch, okay? When it is pushed and it is at the central place, if you feel it like that, from there, you can palpate it from the central point. If it is pushed, it may indicate that you feel in the trachea from the side. It may indicate that the patient could either be having a pneumothorax or pleural effusion. If it is pulled, then just it leads you to some kind of diagnosis where you should be thinking of maybe the patient is having some kind of chest fibrosis or lung collapse. So all these are leading you somewhere. Check the chest expansion. Is the chest expanding correctly, or what? Place your hands on the patient's chest, inferior to the nipples, just as we can see from the diagram here. Wrap your hands around either side of the chest. Bring your thumbs together in the midline so they can touch. Okay. Ask the patient to take a deep breath. Observe movement of your thumbs. They should move apart equally. If one of your thumbs moves less than the other, suggests that there is reduced lung expansion on the other side. Okay. And reduced lung expansion can be caused by lung collapse or pneumonia. You want to establish all those things. You can also check for vocal fremitas. Okay, this is the vibration felt on the chest as the patient speaks. There should be some vibration felt on the chest as the patient speaks. Okay, each chest is tested. Place the middle edge ulna of your hand horizontally, okay, against the patient, and ask the patient to say either 99, okay, repetitively. So you can tell them to be say 99, 99. So as they are saying 99, 99, you should feel the vibrations against your hand. Abnormal findings would indicate that either there could be, if the vibration is increased, there could be consolidation. in the lung tissue. Or there could be pneumothorax if it is the vibrations are depressed. Okay, there could be a pneumothorax, a COPD, or a pleural effusion. Okay, which will also be confirmed by these points that we see here, which could be points that you feel the vibrations from. Okay, resonance could also be checked. Okay, resonance voice, that is voice resonance could also be checked. The expected sound, okay, can usually be heard over the areas all over the lung tissue where you feel that it is down and all those, it also suggests something. Auscultation is very important, and all sounds can be characterized in the same manner as the percussion notes: intensity, pitch, and quality. So you have to know these sounds, everything that is within those sounds that will be produced can be categorized into something that will lead towards the diagnosis. Abnormal sounds would include crackles, ronchi, wheeze, prorab, and others. Vocal resonance, decrease in resonance would indicate emphysema, pneumothorax, pleural thickening, or pleural effusion, as well as heart sounds. So take note of all of these procedures and make sure that you follow them thoroughly if you are to make a thorough diagnosis. Okay, if you are to make a thorough diagnosis, make sure you follow all these thoroughly. Diagnostics. There are many different tests that can assist in diagnosing respiratory conditions and help implement and guide the best treatment options. Amongst them are spirometry. Okay, this is the simple respiratory test that measures the forced expiratory volume in 1 second, FEV1, the forced expiratory vital capacity, and peak expiratory flow rate, PFR, which are important measures for ventilatory function. So there is also spirometry, in other words, that can be used to quantify or categorize the amount of respiratory problem or deterioration that has faced your client. Arterial blood gases are very important. They provide an accurate measure of oxygen uptake and carbon dioxide removal by the respiratory system. Okay. It also shows the balance between oxygen and the carbon dioxide so that you have an idea of how well the lungs are functioning. Okay, because if they are imbalanced, they may influence the way the person, your client is breathing in and out because of an imbalanced oxygen and carbon dioxide quantities and the pH, which is not balancing up if there is any problem. So in diagnosis, you can use a lot of other interventions, including X-ray, okay, which will help to diagnose any of these conditions: heart failure, heart enlargement, rib fracture. All these will be highlighted through this type of diagnostic tool, which is an X-ray. So these are some of the things that you are supposed to focus on. What we've talked about are things that you're supposed to focus on, both subjective and objective. Make sure you take note of all of these points and find out about them. That will help you to make a very thorough diagnosis in respiratory conditions. Thank you for listening.